Thank you very much, Professor Suha, for your kind words. In fact, we are a toddler in the sea of healthcare, and we have been handheld to some extent by the generosity and kindness of the Singapore General Hospital for last almost 5 years. It's the story of last 35 years. When I got trained in All India Institute of Medical Science as a neurologist, northeast part of India was boiling. There was lot of social unrest. People were deserting that part of the land for safety and security. All my colleagues, as Professor Suha has mentioned, was leaving the country for a better life in Western world. And I decided to come back to that part of the country where 50 million people were striving. I thought, let me go back there, give the people a healing touch. But life was not that easy. I had a government job during those times, and my salary was at that point of time, 1,000 rupees would be 20 Singaporean dollar probably. I had my salary at the end of 8 years of job in a public hospital. I wanted to do something. Support was not possible. I came out. I had saved 100 Singaporean dollar out of my residency program. My wife, who is sitting here, was a PhD student in the university. My eldest daughter, who was also sitting, she was sitting here, Priyanka. She was 2 years old. I wanted to do something, make sense in that part of the country with a capital of 100 Singapore dollars. I started it. 25 years passed on. To cut the long story short, I had 3 children. They grew up. We went to hospital, became the destination hospital of that part of the country. When the Prime Minister or the President of India visit that part of the country, I have to keep this hospital ready for them for any contingency, VIP treatment. That was the achievement of those 2 centers. When my children grew up, we sat together and reflected, is it what we wanted to do in our life? 2 hospitals running well, children have become grown up, we can relax and rest. But I told them that I'm not happy because the hospital that we have been creating during last 25 years, 90% of the people cannot come there because of cost. Because of cost. And these 90% of the people do not have access to basic healthcare needs. But where is the answer? Can quality healthcare be created for the benefit of the large majority of the people without compromising on quality? There was no textbook example. We created a hospital on wheel, took half a dozen doctors and a dozen young men, went into the community, interacted with them at a personal level, understanding freshly why they become sick. What is needed to treat them? What is the money that they can really spend? Not what is available at what cost in the market. And I had 3 understanding from that exercise. 1, 50% of the diseases that our common people suffer can be prevented. It is more important to keep them healthy and disease-free rather than treating them once they become sick. Treatment is expensive. It involves cost. There is no guarantee that each and every person that we treat would be all right. So one is prevention. Second, awareness. Most of these people come to the hospital too late because of varieties of reasons. As a result, treatment becomes long. It becomes complicated, outcome becomes poor. And in fact, most of the common cause of death in countries like India in the hospital is because of the late arrival of the patient. It is because primarily awareness. They don't have awareness about the diseases, the symptoms and the consequences. So that has to be created. Third, they do not come to hospital because of cost. Increasing cost of healthcare is a global concern for all of us, irrespective of rich and poor. Unless through disruptive innovations we are able to bring down cost, we cannot make it affordable to the people. And last but not the least, ignorance, ill health, and these two, and poverty, go hand in hand. Unless we are able to break the cycle, they will become sick again and again. So a hospital's responsibility not only stops in creating awareness, preventing diseases, and giving treatment at affordable cost, we must be able to address the issue of poverty. Then only we can make a healthy nation. And with that premise, we started a building block. And that block was, we created a workforce that is called Swasth Mitra, community health worker. At present, we have 5,000 with us, giving them an assured income every month. They work in the community. We have a master plan to create 2 million of them across India in next couple of years. They visit every household, create health awareness, teach them how to prevent diseases, remain healthy and disease-free, and those who have already become sick, they help and guide them to come to the hospital and get treatment at the lowest possible cost. This is the job of the community health worker. They teach them how to maintain hygiene. They teach them about hand washing. They teach them about the menace of tobacco and alcohol and drugs. They also help them to get treated the problems like hypertension and diabetes, so that catastrophic conditions like stroke, heart attack, chronic kidney diseases can be avoided. In addition to that, we created a hospital which Professor Shua has seen. So disruptive innovations in this hospital, even when the patients come, Assam is a tiny state, but the length is 1,000 kilometers, breadth is 150 kilometers. We have a network of transport services for the patient to come to the hospital and go back free of charge. They don't have cost of coming to the hospital, number one. Number two, all OPD consultations are free. This is a private hospital. We have to earn our own bread, but patients are seen free there. There is no discrimination. Rich and poor alike, everybody gets free consultation in that model. Number three, all these expensive investigations are being done at a nominal cost. For example, a CT scan cost is only 18 Singapore dollars. An MRI is at a cost of 30 US dollars, Singapore dollars. We do a coronary angiography at 100 Singapore dollars. For accident and emergency patients, we have number of ambulances which are free for patients. They don't have to pay for it. Once they reach the hospital, accident and any emergency patient, no registration fees, no doctor fees. Number of investigations, the blood test, sugar, urea, creatinine, sodium, potassium, APG, all are being done free for an emergency patient. X-rays are free, ECGs are free, even the CT scan brain is free. We have identified 38 different types of medicine and consumables, which are usually required for an emergency patient, including thrombolytic therapy for stroke and heart attack, are given free to the patients for first 24 hours. And those who need admission cannot be sent home. First 24 hours, they don't have to pay for the hospitalization expenses. This is for emergency patients. So also, surgical packages are at a very, very nominal cost. 1/3 of the public hospital even. We did a calculation. Because of that, innovations in work processes, when a patient comes to the OPD, he comes free, he sees the doctor free, starting from consultation to investigation to report generation to prescription, everything is completed within the same day, so that he can go back home on the same day. On an average, in a public hospital, a patient has to come 3 times to complete this cycle, from doctor's consultation to investigation to getting a prescription. In our system, it is done on the same day. So we save their income. Not only that, in this model, how do you take care of the poverty? These poor people, once they go home, they fall into the trap of poverty. They become sick again. They become sick again unless we are able to strike poverty at its root. Healthcare cannot be guaranteed. Health cannot be guaranteed to them. So, doing extensive research in the community, we give them different income generating schemes. And with these schemes, what we are trying to do, the average earning per person in India for those who are poor is only 26 INR. 26 INR. Through this income generating scheme, we have given them a guaranteed income of 100 INR every day per person. It has increased the income of these people by 4 times, improving the quality of life, ensuring them a better health and access to other opportunity in the society. This has been possible through disruptive innovations. The hospital that Professor Shua and his team had seen it. We make our all hospital appliances by ourselves, up to X-ray OT tables. We don't buy it from the market. Save cost, help the people. We are in the process of making a CT scan machine also with the help of the IIT. We have a collaborative work with Indian Institute of Technology for making a low-cost CT scan machine, making low-cost X-ray machine, making low-cost ultrasound machine, ECG machine, and all. So these are some of the innovations that we are doing. In next 5 years, we have a roadmap to create 2 million community health workers, Swasth Mitra in India. As Professor Shua has mentioned, we are also in the process of creating thousands of units across the country. We should create 3 million jobs. We should create 3 million jobs across India and also healthcare facilities to all these people. Ladies and gentlemen, time is limited. I'd like to give back the platform to you. I'd be happy to answer any questions. Thank you very much for your patience.